Okay, recording has started. All right. Welcome, everyone, to Community Builders Show. My name's Nurse Phil, and on this show, we talk about how you get to help your clients with capacity building and getting really good community access. And we like to introduce you to people to help you do that so you can provide the best care to your clients. Today, we've got very special guests. I've got Shane and Jamie, and I want to introduce them straight up and get them to tell us what they do. So welcome, guys. Thank you for being part of our show. So, Shane, tell us what's your business and what do you do?
Firstly, thanks, Nurse Phil, for having us on. As you said, I'm Shane. This is Jamie. We both work for Coast and Country Community Services Limited down here on the south coast of New South Wales. And we support people with from all walks of life in disadvantage of transport and community services, with a focus on accessibility and accessible vehicles to transport those with disability. So we connect people to their communities via our transport arm, plus provide direct services in their homes and in community.
That is fabulous. So how does it work? So how would it work for accessing? How would they find you to access your service?
So we've got the socials, the Facebook page, the LinkedIn, the website, www.ccccsl.org.au, and we've got our 1300 number. Now, the best way to do it is just Google us. Google Coast and Country Community Services, come up, connect, and we can talk you through your individualised supports. No support is the same. It is individualised. We try and focus on our transport arm because we recognise the difficulty in finding good transport that's accessible for people with disability.
Yes.
So we're just lucky to be able to be an NDIS registered provider of direct supports, community-based supports, as well as have our own community transport companies that we operate.
That's good. So let's break it down a bit there. So you do individualised transport for people.
Yep.
So how would that look like? How do you do an assessment, or how do you work out what things do you need to know to individualise that ability to transport people?
You want to take that one, Jamie?
Yeah. So you call the office or the 1300 number. The people on the phone can help you, and they'll determine your eligibility on different funding and what vehicle you would need to suit your mobility and things like that. So that team there has all the questions that they have to ask you to put you in the right direction.
Oh, that's so. Does the team, like, do you with the types of vehicles? Do you give people a different range of vehicles that they can hire?
So we've got cars, we've got vans with hoist, and we've got buses, which also have hoist as well. So some people, we have SUVs as well, so a little bit of higher vehicles. So if people struggle getting to a car, we have that option there. You still like a car, but you can step up into a SUV. And yeah, we've got the vans. So depending on the questions that the team would ask around your mobility, can you step up into a vehicle? Do you have trouble getting out of a vehicle? Do you use a mobility aid? Do you have a walking frame? And then the team, the drivers and assistants are trained on how to support you to get into the vehicles if you need those assistants as well.
Oh, so you actually, that's really good to know. So you actually train your drivers of how to assist people, because one of the biggest fears that we see a lot with NDIS participants is that the fear of actually getting into a vehicle or out of a vehicle, because it is daunting, because you know, you're going from especially a seated position to try and stand them up without banging their heads and you know, getting skin tears, which is a major problem. So you manage all those sort of things.
Absolutely, Phil. All our staff are trained in how to support individuals. So for others that still require that bit of additional support, we'll also do individual assessments where we will go out. You can see Jamie and I are currently sitting in the car at the moment. This isn't, we are an NDIS provider, but we're always out on the road as a transport provider as well. And so Jamie and I have just done a couple of back-to-back assessments with clients to go out and make sure that we are the appropriate service for them, to make sure that our staff have the training and capability to support their individual needs, or to determine whether they actually require a support worker that can provide that support in the vehicle while there's also a driver. So there's a couple of different levels of support that are required or provided, and that's all done individually on assessment. The process Jamie was talking about, our intake process, that's a generic process that's across the organisation, and it determines under which capacity or funding that you'll actually be supported, because we are a diverse service provider. So we provide aged care services, transport, NDIS services, and then we also provide just transport disadvantaged services for people that may just require a short term. So that intake process is a really key process in determining what the next steps are for you.
Oh, that's so good. So even people with disadvantage that what give us an example of what that would look like.
So a young single mother that has children that is geographically disadvantaged, can't have access to any type of transport, public transport, her own vehicle, family and friends. We want to be a part of that as the transport provider to build that network for her. So that young mother may be entitled to government subsidised transport, where we can provide that to her and her children to get to appointments, to get to shopping, to get to things like that.
Oh, that's a brilliant service, because otherwise they're isolated and stuck alone, aren't they?
Yep.
And don't have that ability to connect, and then you just so many more problems come from that.
Absolutely, and that's what I guess it's about, making transport accessible to a wide range of people. And when I say accessible, I don't just mean a modified vehicle. I mean full access, where we've got clients that live out in rural, remote areas, that they might be on properties, and they can't get in and out because of their physical condition, they're frail, they have disability, and so we go out and assess their properties for access and everything as well.
I was going to mention that our drivers will go out and assess the property in the driveway, make sure that we're using the right vehicle to go down to access the client as well.
Full on. That is amazing. So because that's one of the biggest things is rural, remote areas, they really suffer with lack of services. So you will go and grab them and make sure that you can take them to a community and go to their doctor's appointments and shopping and all that sort of thing.
Yeah. Living on the south coast of New South Wales, we've got a very diverse geographical span. We also go out into Western New South Wales, out Young, Western, Grenfell Way. And so our client base has very different requirements and needs, from their physical supports to their social supports to their actual geographical support. So it's important that we have those tools to be able to assess that and ensure that we are the right service provider. And the other part of that process means that if we aren't the right service provider, we can help them seek out the right service provider.
Oh, brilliant. That's good. So you don't just go, sorry, not for us, and move on. You actually go, no, we've done an assessment. We're not able to suit your needs, but we know someone that can, and here you go. That's brilliant. So at least they're not left wondering, because I know they get frustrated making heaps of phone calls, getting dead ends all the time, and stuck at home at the end of the day. So
that's right.
That's a great service to offer. Well done.
So linking in, people, we link them into the community, but we can also link them to get their services and go see their specialists outside of our area as well. So they just have to be living in our area to be eligible for our service.
I was going to ask about eligibility.
Outside of the area.
Yeah. So the eligibility is you got to be in your zone.
Yes.
Yep.
And then wherever they need to go, within reason, you'll get them there.
Yeah.
We've just recently supported one of our participants through transport. He's also a part of our support coordination service or our direct support service as well. So we were able to build a package for him for 1 day of purchase where he was not only transported to Sydney to a very important appointment for his social wellbeing, but he had a support worker with him. It was a 10-hour shift effectively, but it encompassed transport up there with the direct support as well, so that he wasn't left alone at his appointment. He felt comfortable, although he is able to manage those types of things on his own. His anxieties levels weren't there, so it took a couple of weeks to set that up. But we were able to create an actual individualized package as a once-off for him with that, and he was able to sign off and use his package for it. There's other situations where we just provide the transport only, drop them off at the appointment, then we'll come back and grab them once they're finished.
Get them all. So you cover it all. Oh,
Yeah.
That's a big thing too. So, because that's difficult to manage. So like working in hospital, like being an emergency nurse working in hospital, hospital time is very different to real world time.
That's exactly right.
So how do you manage, like, say someone's got a 10 o'clock appointment, but the doc's running behind and, they're not going to be there till 11:30. How do you manage stuff like that?
I don't know what you mean, Phil. That never happens.
Never.
Being a regional organisation with 5 locations, we've got a very strong community footprint. We know our local teams. We do have quite a large hospital here in the Shoalhaven. We're connected with the Wollongong Hospital. Obviously, Canberra is somewhere we connect quite closely with, getting people from our Bega sites and young Wetton sites into Canberra. And so what we try and do is ensure that we're available. So we've spoken with health. For Canberra, for example, we'll say to them that we will arrive in Canberra at 10 o'clock in the morning and we'll be there, but we have to leave by 2 o'clock in the afternoon.
Yes.
If you can, work with us to have appointments during those times, because we've got to understand the safety of our support workers and our drivers is also very important. And so going over the mountains in the dark to get someone to Canberra can be a lot more risky than them missing their appointment, for example. So we have to, so we work closely with the hospitals to say we will absolutely endeavour to have a person there between 10 and 2. Can we organise for an appointment between that time? And that sort of allows for that ebb and flow of that process in the hospitals.
That's good. So they might book them in early. You drop them off and say 10.
Yep.
They might stay there and then have a bit of lunch, and then you come back at 2. And then if the appointment's late, you're not stressing, we've got to get back because we've got all these other things. That's great. How did you come up with that plan?
We learnt from experience.
Yes. Yeah.
So obviously we experienced a lot of delay, which then impacted on other people getting service. So over the years, like, we've been a provider for over 25 years.
Wow.
But we're an amalgamation of a number of services through community transport, and then obviously taking on other registrations. Jamie and my backgrounds is the NDIS, it's disability supports. So we came on board to look at how we can use that experience to service our customer base as a whole. And it's not just looking at a person primarily with a disability, it's looking at people and seeing how we can bridge the gap or assist them to bridge the gap. So some people may feel that, I don't have an NDIS plan. That doesn't discount you from service. And so we're very fortunate to have other avenues of subsidised supports.
Speaking of subsidised supports, because people won't know, like you just said, they won't understand if they are eligible or not. Can you list a couple of the other options that people have that maybe they can go and seek out and see if they're eligible for?
Yep. So we've got CHSP, the Commonwealth Home Support Program. So that's for individuals 65 and over, or 55 if you're Indigenous. And that is for people that are within the Myaged Care system. So it's a subsidised transport and travel program, as well as social supports and other things. We operate under the CTP program, which is the Transport Disadvantage Program, Community Transport Program. That's for people, as I spoke about, like the young mother or the gentleman that, you know, has no vehicle and he's got a social, you know, low socioeconomic standing. Or we've also got health-related transport, that is subsidised transport for health-related programs. So, you know, a lot of our clients don't realise that we can do 1 or 2 short-term transport where you may be fit and healthy, and then all of a sudden you need to get to a medical appointment. That means you're having a knee replacement. So therefore you can't drive for 6 weeks.
Yes.
You're eligible for that program, so that we can transport you to your physio at a charge, minimal charge, that sees that recovery and rehabilitation while you're transport disadvantaged. Once you're recovered, you're no longer transport disadvantaged, therefore the eligibility
goes on. Well, and that'd be good for too with I know people with epilepsy. Epilepsy is a huge one, because you lose your license straight up. Like, you know, and there's a lot you have to do, a lot of hoops. So they automatically become isolated. So that would really benefit from a scheme like that, where they can get, you know, you guys can come out and go, righto, we'll get you to where you need to go. So it's good to know that you got that support.
And we can reassess as well at any time their situation. So if things change as well, that's when just let us know and we can update and reassess the situation.
Reassess and see what happens. That's really good support. What can support workers do? So, like, because, you know, you've got to run to a timetable, I presume, a lot of it. So what can support workers do to ensure that their clients are ready to go when you turn up?
I think what's really important is understanding that, you know, the people that we're supporting as a shared community have the right to be at places on time. And having a disability doesn't mean that they should have to wait, or they should, you know, for us, we run on a schedule, absolutely. But we also recognise that there's variation in support. So when a support worker is assisting their client, for example, to connect with us, we need honest and true information. If they're going to take 15 minutes to get from the front door to the vehicle because it's a transition process, let us know that. We'll be able to account for that within our scheduling systems, and we'll allow that time. Because what we find is, if we don't have open, honest information, or people think if I tell them too much, it'll restrict the opportunities, what actually ends up resulting from that is isolation for that individual, because we're running late. We can't get them there. We weren't aware that we had to allow 15 minutes for them to transition from home to vehicle, or
that doesn't suit that vehicle as well.
So
I'll say that again. I missed that bit.
Like, someone might have a mobility aid that we weren't notified of, and we've sent a car, and that car is able to take that aid.
Yes.
And I guess from our perspective, if you're ever unsure, give us a call and we'll come out and we'll have a conversation with yourself as the support worker and the person you're hoping to connect to their community. We'll be there. We'll do that. We'll make sure that we are the right provider. And if we're not, we'll point you in the right direction.
That's brilliant. Oh, that's good. So there's a lot of support there. And like you say, transition is a big one. And, you know, like, sometimes emergencies happen, things happen. How do you manage, how would a support worker manage that? Just say they've got an appointment at 10 o'clock. Something happens with the client at, say, 9:30, and they might have to go to hospital. How would they manage that sort of situation?
So you can call on the day and just notify of any changes. Our system also notifies the client the day before at 1:30 of their pickup time. So when the client receives that, either by text, email, or it's an automatic voice phone call, at that time, then if they need to reassess their situation, just give the office a call and we can adjust your schedule if it means that your appointment has changed, because sometimes the doctors do change their appointments, or if you need to cancel your appointment as well, so your transport for the day.
That's really good. You know, because you said you do transport in vans and things like that. Do you ever get anyone concerned about, like, because I know we've just been through like the COVID and all these respiratory things, and people are wearing masks and things now. Do you have any contingencies, or do you find any clients have any concerns about travelling in vans together?
Our finding is people are very honest with what they want. So if they are a little concerned about traveling with others, and that's the option that we have, we can reassure them that we sanitize all our vehicles ongoing. So even though the COVID pandemic seems to have come to somewhat of an end, our infection control practices have not ceased, and they will not cease. So the vehicles all are carrying disinfectant wipes. The drivers wipe down all the high touch areas once our clients get out of the vehicles, ready for the next clients. Although mask wearing is not mandatory, we support that. We have masks in all our vehicles that are available for individuals that may not be confident in not having them on. So we have them to provide. And at the end of the day, we want it to be the safest transport for those that travel with us. So by telling us how you feel about that, we will find the safest solution for you.
Brilliant. No, that is great news, because you do see people that are very nervous about it, and like, oh, I've got to be wearing a mask all the time, and making sure that the areas are clean.
Yep.
So it's a big one. I remember I had to do some a nursing assessment for a client who was put in the back of a taxi. So he was wheeled in his wheelchair into the taxi, and the taxi didn't secure him down properly, and the taxi hit the brakes, and he went through the back seat into the front seat and got major injuries from that. And so now he has a big phobia about transport, as you would. How do you alleviate, like, how, these things do come up sometimes, but how do you alleviate the client's anxiety because, of bad experiences?
Yep. I might take this one, Jamie, and I might give an example of a service that we provided that before we provided it, a lot of our drivers didn't realise that this is what we could do. So we had a family contact us. Their son, who is on an NDIS package, he had to have major surgery on his legs, and he was in year 6 transitioning into high school. But the surgery had placed him in a position where he couldn't travel in the family car. Now, this was so. In any other situation, he's mobile, but because of the surgery as well as his additional supports, it added a whole different level of anxiety for him. So what we did was we first and foremost went out and met with the family and the young fella, introduced ourselves. Then what we did was bring out the driver that would be transporting him and the vehicle that he'd be going in, and introduced him to both of those. And so whilst we weren't transporting him at that time, we were preparing him for that. We also asked that his parents not travel in the vehicle with him, but behind him in their family car, so that he knew they were there to keep him safe, because he was a very independent young man.
Yeah.
Just wanted to go to his year 6 graduation and his formal on his own, like other kids.
Yes.
Coming in a van because of his disability was a bit, So he turned up. It was like he was, turning up in a U-Butte mobile, what do you want to call it, vehicle. And his parents turned up like every other parent were there to take photos as he got in and out. So we talked through that process of what that would look like. And although he was still very anxious, he trusted us. So we built that trust with him. He trusted the driver, and we made sure that driver was available. They then, after that, consequently, I think we provided another 4 or 5 trips to him whilst he was still recovering.
That's a great story. That's great. So he got to his graduation.
He got to his graduation. He's now in high school, doing his thing in high school. He no longer requires our support, but they know that we're there if they ever do required.
come back. But that's great that you actually will go out. That's going above and beyond to make sure you can help people with their anxieties and make them feel comfortable, because it's a real phobia. We do see it a lot out there.
Yeah.
So no, well done. That's fantastic. Is there anything else that we haven't covered yet that you think, oh, Nurse Phil, I wish we could talk about this? Is there any other parts that we haven't covered?
You got anything, Jim?
I don't think so. I think just communication between the client, the support worker, and us, and building that relationship is most important. Like, we've got clients that don't want us to touch their wheelchair, and they will put them, like, we will only raise them up on the hoist, and they will push themselves into the vehicle, and we'll just lock them down. So we've got relationships like that as well, which is fine. Like, if people don't want us to touch their wheelchairs, that's fine, and the drivers are aware. But that's going down to communication. So
Yeah, that's cool. And I was just going to ask you a question about that. I know that we had a chap. He loved his little Holden Ford Ute, and he was wheelchair bound, and they had this contraption set up that would hoist him from the door hinge into the car.
Yep.
But the thing was very heavy to set up and mobilize into the car. How do you have like machines or something to get people into a car?
No, our cars. I guess the reason we have a diverse fleet of vehicles is to provide the least amount of restriction. So our vehicles having the hoists and the lifts in them are there so that it minimises risk for the first instance, and so that they transport. We also have modified people movers where we've got the ramps into the vehicle and you go into the middle seat, and so you're connected with the driver. So it's like you're driving in a car.
Okay.
Because there are people out there that don't want to sit at the back of a van while the driver's up the front of the van. It takes away that whole connection.
You want to have a chat. Yeah,
that's right. So we do have modified vehicles that sit the participant with the driver at the back of the driver in the middle section. We don't transfer mechanically into vehicles, into cars, but we do have mobility aids that assist people that are frail aged or that can't spin themselves. So a swirly seat, swivel seat it's called.
Swivel seats.
Yeah. So where that goes on, that goes into the vehicle, and they sit on that and then swivel into the seat more comfortably. We assist by holding at their ankles if they feel comfortable with us doing that. Our drivers are all trained in those practices.
Those moves, because it is tricky manoeuvring, and being support worker, like knowing that you've got to contort yourself to get in the cars. Right. There is a workplace health and safety risk to it.
Yep.
And so, getting the right training and knowing your body positions, very important. Very important. No, that's brilliant. Well, amazing chat. I reckon there was so much gold in there, so much great information that people out there can really access and know that their clients can be taken to their appointments, go shopping, get out there, and that you guys won't just be like turning up, beeping the horn. It's like you'll come in, make sure that you're safe to do it. You can get into the car. Support worker can come with you. You know what I mean? It's not like beep, beep, get in here. Yeah. You're actually going, no, how long does it take to transition? Because that's a very important thing. There's people that, on a wheelie walker, might take 15 minutes to get to the front gate, and that's something that, you've got to be counted in for. Or there might be even like wet weather, how to manage those sort of situations when you got rain and slippery floors.
At the end of the transport as well, for 5 minutes before they go into their appointment.
Yes. Yeah. Love a chat and then go in and come back and have a chat on the way home. Yep. So, no, brilliant service. Thank you so much for coming on our show. We really appreciate it. And just for everyone to remember again, can you give us your name and how we can find you?
So, Coast and Country Community Services Limited. And the easiest way to find us is via our website at www.cccSL.org.au or Google Coast and Country Community Services and we'll pop up.
Lovely jubbly. Well, Shane and Jamie, really appreciate having you on. We wish you the best of health and thank you for showing everyone on Community Builders Show what else is out there that can help their clients improve their capacity and get them access to the community. So really appreciate it. All the best.
Thanks for having us.
Take care.
Cheers. Bye.
Yeah.